Thank you for joining us in this business webinar. As you are aware, we are fully committed in making sure that we recover more strongly in Kirklees. Over recent months, we've had to close down on a temporary basis some local businesses. Our health and safety executive and our local council officers have worked extremely hard to make sure that these measures are only temporary. The only way we will become more stronger in our recovery is to make sure we control the virus, we keep on top of it, and we learn the lessons. That's why we will be sharing on webinar the lessons we have learned and how we can share our experiences and get on top and make sure we control the virus. We've also got some guidance that we can share with you in how you can manage your workplaces a lot more effectively. We've worked really hard, and I'd like to thank Thornton and Ross and the Health and Safety Executive for their help and support. Together, we will recover more strongly. Enjoy the webinar, and once again, thank you for all the help.
Hi, my name is Mark Kirkup. I'm the Vice President of Operations at Thornton & Ross. I'm going to take you through today the journey our technical operators take on a daily basis as they arrive on site through to the end of their shift. Here we're at the entrance, the employee entrance. You can see on the ground behind me some markings. Those are the 2-metre markings as a visual cue to help people try to keep in mind what that 2-metre social distancing looks like. And you'll see many visual markings throughout the site, but it's much more than that, as I'll talk to you later. Okay, so this is our main employee entrance, and it is somewhat of a pinch point for us. It was identified as such by our health and safety team, who did a full assessment of the site. And then you'll see that there is quite a lot of markings on the floor here to help manage the flows of people as they arrive on site. We do a temperature check for all employees as they arrive on site. One of our supervisors or managers would administer that temperature check to make sure that people don't have that high temperature. In this area as well, we have a notice board with all the latest updates and information that people need to be aware of. So we're keeping people informed constantly as things evolve in the wider environment. Okay, so you can see I'm wearing a face mask as I arrived at this location, and recently the government guidance and the evidence seemed to be more that face masks had some value. So we have actually introduced that as people are moving between their workstations, so travelling in common areas. In addition to that, something that came out and evolved really as we went through this journey that we've been on, was that there are many processes where we've got operators who are moving between processes or having to stand side by side to complete a process. So in the case here, you can see that we've got 3 operators that stand side by side within the 2-metre social distancing. So what you can see there hopefully is the perspex barriers that we put up, and you will see any number of those as you walk around the site to make sure that we provide that social distancing wherever practical. So you can see our new "Don't stand so close to me" signage that we put up fairly recently, actually, and it's a constant battle just to keep reminding and reinforcing the message. The area I'm in now is a locker room for our employees to leave their personal belongings before they go into the clean room environment for our pharma manufacturing facility. And as you can see, it's fairly tight and constrained space. So we've introduced a one-way system here, which is marked out by arrows on the floor to ensure a flow of people through, to avoid people crossing as much as is practical. And that's what we're trying to do throughout our site. Our supervisors and managers are constantly monitoring these areas to try and reinforce and remind people of the rules and the regulations. And in addition to that, again, to try to minimise the contact, we've introduced staggered breaks and also a stagger to the start times of the shifts to allow people to flow through in a bit clearer area, because you can imagine there's lots of people arriving in one hit otherwise.
Okay, so we're in our canteen facility, which is usually the hub and the vibrant heart of the site. And usually behind me you'd see a queue of people waiting to be served their hot meals, breakfast and lunch. Unfortunately, with social distancing challenges, we've had to put an end to that for the time being. And we've implemented a one-way system in here and then a separate exit from the site, from the facility. We've also had to stop the provision of hot food, unfortunately. What we have done is introduced a sandwich ordering process, so people can order in advance, the sandwiches can be made up, and then they're laid out for the different departments in different areas, which is making much quicker people coming in. They're able to grab their sandwich, sit down, go and have something to eat. We've also laid out the tables in a different way to enable social distancing, and it's just one chair per table. Now, I have to say most people are very compliant with these guidelines, but in some cases we've had to do a level of enforcement, and you can see here we've indeed had to lock up some of the spare chairs to stop people taking those away. So it's a constant process, a constant battle and reminder, and a constant level of vigilance that's required. In addition to that, in other parts of the facilities, we have occupancies for different meeting rooms and offices to help people get accustomed to the level of what's appropriate in different parts of the facilities. So, thank you very much.
Moving through what have been incredibly difficult times over the last 6 months. Manufacturing remains a hugely important part of our economy, over 27,000 jobs, and contributing nearly a quarter of our economic output as a district. So this webinar really provides an important opportunity for a range of technical experts that I'm going to introduce in a minute to share their experience of how they've been working with different manufacturers to keep them trading securely and safely. And moving forward over the next period, that's going to be even more important. So just to introduce our panel, and then I'm going to ask a couple of them in particular just to say a few more words. Oh, and I'm sorry, I think the webinar may just have cut across right at the start. So just to reintroduce myself, my name's Chris Duffield, and I'm Head of Business Skills at the Council. I'm going to introduce the rest of the panel now. So we have Louise Redgrove, who is Her Majesty's Inspector of Health and Safety for the Health and Safety Executive. We have Donna Roberts, who's the Lead Protection and Intervention Control Nurse for Kirklees Council. And we also have Mark Kirkup, who's the Vice President of UK Operations for Thornton and Ross, one of our most important manufacturing companies. So the format for this afternoon's event, having seen that introductory video, I'm going to ask a couple of those speakers to say a few more words, and then we're going to answer some of the questions that have come in from businesses. And so without any further ado, I'd just like to introduce Donna to to say a few more words about this from a public health perspective.
Hi, thank you, Chris, and thank you for inviting me to the webinar this afternoon. My name is Donna Roberts, and I'm the lead infection prevention and control nurse that's working alongside a team of infection control specialists within Kirklees Council. And we understand that during the COVID pandemic, many people have been affected in many different ways, from physical, emotional, and it's caused a lot of anxiety for the general public and especially people working within businesses. My team and I have been working very closely with a lot of services across Kirklees over the last 6 months and been offering advice and support really to both the public, schools environment, care homes, and in particular businesses really in our area where they may have actually identified positive cases within their workforce. So I suppose I'd like to just talk to you a little bit around the established outbreak reporting process that we have here in Kirklees, and that really, I suppose that you're aware that obviously COVID positive cases have been increasing both nationally and locally, and we've currently got areas in Kirklees with additional restrictions in place, but it would be remiss of me as an infection control nurse not to just remind you all of the key sort of signs and symptoms of COVID, which obviously includes you may develop a high temperature, a new and persistent cough, or a change or loss of taste and smell. And thankfully, most of those people that are testing COVID positive at the moment are experiencing very mild symptoms. But the advice really in terms of infection control remains the same, that everybody's vigilant about those symptoms and recognise those symptoms, have a think about whether or not there's been an increase, sickness and absence in your workforce. And in terms of combating the spread and transmission of COVID, we're still asking people to wash their hands frequently for at least 20 seconds, use hand sanitizer, socially distance at least 2 meters apart from other people, have a cough etiquette, so basically catch it, bin it, kill it, and wear face coverings where it's appropriate, especially on public transport and in supermarkets, etc. In terms of, we think it's probably useful for you to know or understand the definition of an outbreak. So an outbreak is defined as 2 or more suspected or confirmed cases of COVID-19 in a particular setting. So 2 individuals that have displayed symptoms and had confirmation of those symptoms within a 14-day period within one environment. So Kirklees Council have essentially had an outbreak plan in place going back from 2012, and basically we've adopted that outbreak plan to enable us to monitor COVID-19 incidents in our area. And incidentally, there are actually step-by-step guidance and instructions that have been produced by Public Health England. They are action cards which actually helps people to go through what to do in the event of a COVID positive outbreak in a business and giving those step-by-step instructions. However, the infection control team and environmental health team are on hand to provide additional assistance and support in the event of an outbreak occurring in your business. And certainly that's something that both the environmental health team and my team have been involved with, is actually making site visits in order to help make environments more COVID secure, and those have been really beneficial for both us as an infection control team and our learning, but also for the learning of the businesses that we've been involved with. So without going into further detail about the process where we are alerted and informed by PHE of cases, I suppose it's important to say that we are on hand to give out that specialist advice and support. Make those site visits in your premises, because every premises will be different with a different layout and a different workforce undertaking different tasks. So that's about it from me, but I'm happy to answer any questions that occur during this webinar.
That's great. Thank you, Donna. I'm now going to ask Louise Redgrove from the Health and Safety Executive just to say a few more words about your recent experience of this issue, particularly in a business context.
Hello everyone, thank you very much for the introduction. Yes, HSE has been working throughout the changes, so the last 6 months or so. Our working practices have changed very differently to what we did before, but essentially we've been working on social distancing concerns as well as normal concerns that we receive from the workplace. We started doing those back in April, and we did them majority remotely through using IT, FaceTime, photographs, videos, etc. But since then, we've increased the number of site visits, and now more often than not, we would, in response to a concern, visit the appropriate site. We've also been doing some spot checks in response to the government request to do so, and those are proactive spot checks. Some of them are arranged with the workplace, some are not, so very much similar to the previous proactive inspections that we used to do. Some of those spot checks have actually been screened in advance, and many companies have received an initial call from a call centre that we've set up, asking some basic questions about risk assessment, about controls, etc. And those particular employers fall then into two categories. They either pass, for want of a better word, that those questions, and some of those then go on to actually receive a visit, but not because with any concerns, just the fact that we want to have an assurance program that is working and everybody is putting the appropriate controls in place. Those employers who raise a few flags through those questions would then receive a visit from a local inspector where we could deal with those questions or concerns in person with that workplace. We've also been working with the local authority on some of the outbreaks. They inform us where there's about an outbreak in an area where we would enforce, and then we would make contact, and often we would do a joint visit with the local authority to advise or support, etc. My colleagues within the policy department have also been working with the government for the industry guidance. So that's the guidance that you see on the government website. And of course, we've also been dealing with the PPE issue, and we've been working with the central government PPE management site, working quite long hours to make sure that PPE is the correct standard. In the main, most of the companies that we are dealing with, whether that's through telephone or face-to-face visits, are trying their hardest and putting a significant amount of resource into ensuring that they are COVID secure. And as a result of that, the vast majority of visits that we make result in no enforcement action whatsoever, no further advice. Occasional, a few verbal advice, but nothing stronger than that. And most importantly, where we have been, companies have welcomed our input and have then implemented any of those verbal advice as quite speedily, which is what we want. We want the controls to be there, we want the controls to be working. Our approach in that situation is that if the company can demonstrate that they meet the requirements of the government PHE guidance for the activities on their site, and as Donna mentioned previously, every site is different, every activity is different. But if they can demonstrate that they've reviewed that, assessed it, put in appropriate controls, then we would consider that you've done all that's reasonably practicable to control the risk of COVID transmission. And therefore, there would be no breach in the Health and Safety at Work Act. And as I've said before, the vast majority of people have demonstrated that. In the main, where we've given verbal advice, and in a rare occasion actually made some enforcement, are in areas, the communal areas, so the clocking in machines, the entrances to site, canteens, smoking areas, those kinds of places. Also the difficult area of adhering to those new rules that you're putting in place. You know, how are you supervising the staff? How are you monitoring your controls? We've also given verbal advice with regards to peripheral work-related activities. So how do they get to work? Do they car share? Do they go on public transport? Are your staff socialising outside of the workplace, and what you can do about it? And we've also been given some verbal advice to employers about how they consult with their employees or their representatives to make sure that everybody understands that the rules are there to protect them, and that they are there for a reason. And overall, really, if we can get involved quite early on, if you've got any concerns, if you've had an outbreak, the sooner everybody is aware of what's happening, then obviously we can resolve any issues you may have, or reassure you that what you've got in place at the moment is reasonably practicable, and there's really not much else that you can do in such a difficult environment. So that's what we've been up to, but I know there's quite a lot of questions that have come in, so we'll answer those at the appropriate time. So that's all from me. Thank you.
Louise, that's great, thank you. And I know some of the areas that you touched on there will, have do reflect some of the questions that we now want to come on to. So without further ado, I'm just going to run through some of the questions that we've had, and we'll bring colleagues in as and when appropriate. So the first question actually does hark back to one of the points you were raising, Louise, and perhaps you could come in on this one first, and then I'll try and bring Mark in as well. So the question is, I have controls in my business, but how do I control staff behaviour when they're not on the premises at break times or outside working hours?
Yeah, it's a really good question, that, and that's one thing that's come up quite a lot in some of the outbreaks. I think if we can split that question into two parts, what can we do at breaks and what can we do outside of working hours? So if we take the break times, that's about looking at how many staff you have in a particular break, whether it's a tea break or a lunch break, and where are they going. Now, you'll have to provide some area for them to rest. That's something that everybody should be providing anyway, no matter whether we're in a pandemic or not. But often these areas, whether they're canteens, whether it's just a room with some tables in so they can eat sandwiches, etc., some of them may be quite small. So it's about organising that space, saying to staff how many can safely be in that space at one time, and be very clear about that. And then if you have, for example, 20 staff going on lunch at the same time, and your room will only take 5, then clearly you have a decision to make. Do you try and find some extra space for them to go? Do you split it between indoors and outdoors? That's fine in the summer, but what happens in the winter, and especially when it's raining? Or do you go the other route and do you look at staggering your breaks so that you actually only release 5 people for a break at any one time? And as we've touched on before, there's no one size fits all. It will depend on your numbers of staff, where they go, and whether whether they're smokers, for example, because that's another area as well. Smokers tend to congregate quite close. They'll have a chat while they're smoking. You need to make sure that you have got clear rules in place so everybody knows where they can go, whether that's written rules on posters, whether it's markings on the floor, especially in smoking areas, whether it's a poster that limits the number of people that goes in a particular room. And with any control, you need to make sure that it's being monitored and supervised and regularly enforced. If we can move on to outside of the workplace, all you can do as an employer is to reinforce positive behaviour. So whatever the social rules are for your area, if you're in a local lockdown, you can reinforce those through communication to staff, through posters on the way out, etc. You can advise staff not to car share, or if there's no other option to car share, then what is the guidance about, how many people can you have in a car? Should the windows be down? Yes, they should. Should they be wearing a face covering? Yes, they should. You can't enforce that, but you can be quite strong in your guidance. I hope that answers the question.
That's great. No, it is a big question. Thank you, Louise. And Mark, from your perspective, I know that you're looking at this issue not just from the perspective of the Linthwaite operation, but some of your other European sites as well. So I'm just wondering how you've tackled that issue of reinforcing some of these messages for people outside the workplace.
Yeah, well, just to reiterate what Louise was saying, many of the things that Louise was recommending or suggesting things that we've implemented on site. So we have introduced staggered breaks. So we are fortunate that we have quite a large canteen facility, and we've introduced staggered breaks. So we've got limited numbers of people, and there are things. So there's lots of signage in reminding people of keeping social distancing. And it's a bit of a sad environment compared to its normal hubbub, with lots of people in there, lots of conversation going on with people sitting individually at tables around the canteen. But we've, that's what's required, and people understand that. It works reasonably well. In the main, there are a few individuals who really seem to struggle with the guidance, either because they feel it doesn't matter, or it's they disagree with the direction nationally that we're taking. So we've had to go to the extent of locking up the extra chairs in the canteen, so putting a padlock on those extra chairs so that people can't help themselves to another one and then sit too close in the canteen area. Again, markings on the floor for the areas where people are clocking in, so that people have that 2 meter distance marked out on the floor, and they can use that as a visual aid. And similarly in the smoking shelters as well. We've stopped the hot food service, at least for the time being, since this started, because that was people would queue up to get their hot food, their lunch, instead of which we're now offering sandwiches which people pre-order, so that they're not having to queue. They can go and grab the sandwich and go straight to a table. So there's things that you can do to minimise the impact. Again, because we are an over-the-counter pharmaceutical manufacturer, it really matters. The products that we make really matter to people, and that's something that we've played on with our staff as well, to remind people that it's really important that they stay healthy, that they stay safe, they stay healthy, because it matters that we are able to continue to supply our products. And then we continue to maintain social distancing and all the other good practices. In terms of the broader, again, just as Louise said, really, in terms of the outside of the office in their personal world, it's just reinforcing again that message that they need to maintain and adhere to these. But it is guidance outside of that area. We stress that we require staff to stay healthy, look after themselves, and stay healthy so that they can continue to do their duties at work. That's part of their responsibilities, but you can take that only so far.
Thanks, Mark. That's a very helpful response. And I think the next question probably touches on a couple of the points that you raised, but and let's probably again bring Louise in first on this one. How do you recommend that I stagger start and finish times so that people don't all enter and exit together? And how long do I make the intervals in between? So quite a detailed question there.
Yes, it is. And unfortunately, I'll only be able to give sort of a generalised answer to this, because it will depend very much on the workplace, the space available, and the number of staff that you have. and also the processing. If you have a continuous process where you have to have individuals at certain workstations all of the time, then that's going to be very different to if you have workstations on a process where a whole department doesn't have to be there, and it's not going to hold up all the other processing prior to that. It will depend on how long it takes for workers to get from their place of work to wherever it is that you want them to go. So if it's for a tea break, if it takes them 30 seconds to get there, then that will inform how long you need to wait before the next set of staff can go, obviously taking into account how long their break is. If it's quite a complex operation and there's PPE involved, personal protective equipment, and it takes them 5 to 10 minutes from the point that they clock in to the point that they get to the workplace, then that will have to be taken into account as well. So what I've seen examples that work quite well are the times that people come onto shift is staggered anywhere between sort of 5 and 20 minutes. And obviously at the end of the day, the same again. And break times, I've had an example of where the 15-minute break for the whole staff has, because there were so many people, they've had to start breaks at about 10 o'clock and then there's several hours before the breaks are finished, so to speak. So I'm not going to be able to give a definitive answer to that question. But I think as long as you're looking at the number of staff, looking at the space that you've got, and you've made a reasonable attempt to solve the problem that you have. So is it a problem with the canteen, or is it just a problem with clocking on? With clocking on, if you've got a queuing system outside with rigorous markings where you're supervising it, you might have natural staggering, and you might not have to do anything else. But if it's about breaks and canteens, etc., you might need to do something a little bit more formal and say, I don't know, Team B go on the hour, and then Team A go at 15:15, etc., assuming, of course, their break is 15 minutes. You may want to do it at 20 minutes and then have a 5-minute window where Team A are coming back and Team B are going out, hopefully in a one-way system so that they don't meet. I hope that gives a little bit of guidance.
That's very helpful. Thank you. Mark, I'm just wondering if you had anything to add to that in terms of how Thornton and Ross have approached that particular issue.
Yeah, well, again, very much Louise is on the money, really, in terms of the way that this tends to operate for us. And it's been the site in Linthwaite it has some more modern parts, but it has some older parts as well. And sometimes the corridors are quite narrow, so those one-way systems have been important. And there is, because we have a clean room environment for many of our staff, not all, but for many of our staff. So there is a natural sort of delay between them leaving their place of work and arriving in the canteen for their breaks. So we've continued to monitor it and work out what works best. Supervisors and managers are all part of the approach for us, and also there's an element of peer pressure as well from colleagues. So we communicate very clearly what our expectations are, and if people are coming up for their break and there are still people in the canteen, then they're very quick to let them know it's time you were heading back to work now, because we want to have a sit down. So I think it's each site is different. In our case, the people arriving at the beginning of the shift come in through a single employee entrance, which we've marked out all the way out to the car park, the 2-meter gaps, and that again provides a level of break as people, as they come in, they have the temperature checked, they'll clock in, they'll go change into their workwear, and move on, and that process sort of creates a flow at the right sort of speed for us.
That's great. Thank you, Mark. Just a reminder for those of you who are watching on our YouTube channel, if you do have any questions during the webinar, you can ask them via the chat box, and we'll do our best to answer them for you. Just to move on to the next question, which is probably quite a seasonal one in practice, given that we're moving now into the autumn. Question just about really sort of heating in manufacturing premises. Question is around really whether it's possible, whether particularly for those premises which use blowers, concerns about the potential spread of germs, and also concerns that if businesses are not able to use their blowers, temperatures might fall below the minimum working temperature. So I'm just wondering, Louise, from an HSE perspective, what advice can you give to businesses who are dependent on that form of heating their premises? Sorry, you're on mute, Louise. Sorry.
Sorry. Schoolgirl error. There is an issue with blowers in that ventilation is one of the key measures that you can introduce to control risk. If you're bringing in fresh air from outside the workplace and having it being pulled in and pushed out, then if there are virus elements in the air, then you're essentially attempting to get rid of it. Very non-technical answer there. However, in the summer months, a lot of people use fans, and that also recirculates the air, as would a heated blower recirculate the air. So it's really about where you place it and where the air is being circulated to. So I would say, again, it depends on the workplace. It depends on the heating element. Is it in the ceiling? Is it recirculating air above head height? Is it a heater that actually blows air sort of at foot level? And from there, the warm air rises and warms the layer above, etc. I would say don't worry overly about it. Donna may say something different on this, but I think as long as it's not blowing directly in somebody's face, and as long as you're keeping up with the cleaning regimes, you should be fine. If you do decide to stop the heating and you feel that temperatures are going down, especially in the real winter months, then of course thermal clothing would be advised. Again, it would depend on the temperatures, it would depend on the floor that people are stood on. If it's a concrete floor, for example, with no heating, that can get very cold. So you could have thermal inserts in shoes, gloves, fleece type clothing. But of course, you need to consider whether that additional clothing would create an additional risk depending on the kind of task that they're doing. So I think in the first instance, just look at your heaters, see where they are. Are they recirculating internal air, or are they pulling air from outside of the building, and then go from there? There is also advice on the HSE website about that as well. So you can have a look at your own specific circumstances and decide which route you want to go to.
Okay, thank you. Donna, did you want to add to that question?
I think, as Louise has pointed out, it's establishing what mechanisms and mechanics you've got in place in terms of that air circulation, looking at making sure that that's maintained and serviced on a regular basis. If it's got filters within it, that they're replaced as per manufacturer's instructions, etc., and just have an understanding really of the system in place in your company.
That's great, thank you. Just a question from one of the businesses watching the webinar, and it's just back on the previous discussion that we had around staggered breaks, etc. So the question is it recommended to leave an area such as a canteen empty for a period of time before the next staggered break, or would cleaning tables etc., suffice? Louise, I just wondered if you had a response to that one.
Yes, I do. I would not necessarily recommend an empty period. It's about the, so it's about identifying the touch points within space. So have the previous set of staff use the kettle, use the microwave, use the vending machine, touch the chairs, touch the tables, that kind of issue. What instruction do they have? Do they have to sanitize their hands in? Do they have to clean, use something, lights in that area, cleaning spray, that kind of issue. If you do all that, then the time split just be enough so everybody can leave the room before anybody new comes in. What about you, Donna?
I would say the same. In our experience, Louise, in visiting some of the premises, we've actually actively encouraged that staff take some responsibility, that when they're in that canteen area, they take responsibility for cleaning the tables afterwards. So we're asking companies to make sure that cleaning products are readily available for staff to use. Certainly in canteen areas and where you might have water dispensers or food dispensers, etc. So any of those high touch point areas within that sort of canteen area really is cleaned on a regular basis by every individual that uses it.
Okay, that's very helpful. Thank you. A couple of questions.
Chris, if I can just add, I think the key thing here is to get across to your staff that we're all in this together. There isn't. These that we were talking about, the heating systems. We've got a variety of different heating systems across the site, different from the warehouse to the offices to other areas. We'll do a risk assessment of each of those and assess the level of risk. But there's no black and white, or it's not all of this is not clear cut. We're making judgment calls all the time, and in terms of the canteen facilities, we've heightened the frequency of cleaning, so we're doing more regular cleaning by our cleaning teams. But in addition to that, we provide cleaning materials for staff who can clean the table before they sit down. There's also the gels, the alcohol gels for the hands as well. So it's just saying we're all in this together. We all need to work to minimize the risks, and we're providing you with these, as well as doing a higher level of cleaning. We're providing the materials for you to clean as you go. It's the only way that we can get through this.
Okay, thank you. A couple of questions now about face coverings. So one of those is the business asks, staff don't want to wear masks due to the heat. Shields are preferable, but is this allowed? And then there's a second related question, which is just around communication. How can staff communicate in a noisy factory and wear masks as well, because no one can hear? So the point about whether it's possible to wear face shields, Louise, if you could respond to that a bit first.
Of course. First of all, you have to ask yourself, why are they wearing a face mask, and what kind of mask is it? Is it a face covering, or is it a mask that you are asking them to wear because you've identified for another reason other than COVID? So if, for example, they're having to wear a half face FFP3 because of dust or another kind of COSH control, then obviously they would have to continue to wear that kind of mask. But if it's just the general face covering that you're asking them to wear, then a face shield is a fine alternative. And a range of different face coverings could be provided so people can get the right one for them. What happens when they don't get the right one, if it's too big or it's too small, it doesn't fit right, then they'll continue to fiddle with it throughout the course of their shift. And then, of course, you're encouraging them to put their hands to their face. The mask, exterior of the mask may have the virus on it, and therefore they're touching the mask, transferring it to their hands, and which then could be transferred to surfaces or even to themselves when they move it over and above their nose, for example. Or some people like to put it under their chin when they don't need to wear it, but then they know they have it. Again, that should be discouraged, because again, they're fiddling with it all of the time. So going back to the question, can we use a face mask and a face shield? Alternatively, of course you can. They do either. Sorry, was there something else to the question? Oh, it's noise, wasn't it? Right, so really common question we see quite a lot in manufacturing environments. This, again, you're going to have to look what conversations are being having in the noisy environment. Is it general chit chat, or is it production specific conversations? If it's production specific, then you have to think to yourself, right, well, can we do this elsewhere? Does it have to be done in that noisy environment? Can you remove yourself to a side room, which is large enough for the people that need to have the conversation to have the conversation? If you can't do that, then I've seen some really creative ways to have conversations about subject matter that appears regularly on the production line. So if there's a problem with a machine or a problem with the product, that happens quite a lot. I've seen people use pre-printed cards so that they can show it to the person they're trying to communicate with. I've also seen hand signals used, old-fashioned pen and paper, whiteboards, and for those that have got quite a big budget, you can have hearing protection with inbuilt microphones, etc. But for your average employer, they will probably be out of your budget, and therefore we would probably not consider that to be reasonably practicable, because the cost would outweigh the benefit. So there's a range of different things that you can have, but it's about understanding what communications are happening and whether they're essential. If it's not essential, don't do it.
Okay, just briefly, Mark, I'm wondering if you've got any sort of specific experience of that issue from a Thornton and Ross perspective.
We certainly have faced the challenge of the volume, and we try to where we have, we'll have a root cause analysis work about a breakdown on a particular machine or whatever. We try to take those out of the noisy environment so that people can continue with that exercise in that environment. We have actually invested in a set of intercom headphones and mics, although it certainly doesn't cover for every situation, but where we've got a large group kind of discussion to take place.
Okay, thank you. I'm going to move on now onto a question for Donna, and the question, I suppose, is quite broad. I have an outbreak. What do I do? There is quite a lot of guidance around, and to some extent it's confusing. Is there a simple flowchart or process that I can follow?
Hi, that's a really good question. I alluded to the PHE action cards earlier, which, like I said, give step-by-step instructions for companies and staff. However, it does depend on how you're informed of an outbreak, and it might be that a member of staff contacts you to say that they have had a recent positive test, followed by another call from another member of your team, again, that identifies that they've also tested positive, and therefore with those two confirmed cases we have got an outbreak situation. So ideally those two members of staff that have tested positive should self-isolate for 10 days, and their household contacts isolate for 14 days. And by self-isolation I mean not leaving home, not going to the supermarket to get that last minute bit of shopping in, but actually to remain indoors and away from all others outside of their household. In terms of the other ways of being notified of an outbreak, and that might be through the track and trace through Public Health England, or it could be that the infection control team, HSE, or the environmental health team have got notification from Public Health England about a cluster or a number of cases associated with the same company. But from experience, it's usually that staff are actually contacting the manager to say that I have had a positive test.
Just a quick follow-up to that question as well, done it. So in the event that an employee, again using track and trace, an employee is a contact of someone who is tested positively but has not actually tested positive themselves, what should the employee do in those circumstances?
In terms of the employee, they need to think about that positive case and who they may have had contact with whilst at work. So it could be that we can identify an individual that works within a separate work stream or production line or a particular team, so that we can look at and help us, well, as infection control environmental health, we can assist with trying to determine who that individual might have had contact with whilst at work, and that would be dependent on their role within the business, and whether or not they're working in a specific team that we could basically look at excluding maybe temporarily until we work through who this individual's had contact with. And it could be just going back to something that was raised earlier around car sharing. So consideration would be needed from the managers to have that think about how's that person travel to work, and if indeed they've car shared with other individuals, because those other individuals would be deemed automatic contacts.
Great, thank you. That's very helpful clarification. Just another quick question for Louise. How do I distance staff in my workplace when the workstations and machinery are obviously fixed?
Yes, that can be difficult. So, as we all know, the guidance is 2 metre social distancing where it's possible. Now, again, you'll have to look at where are your workstations, where are your machines. If they're particularly heavy machines, they're bolted to the floor, etc., it may not be possible to move them. If it is a workbench that is easily moved, so for example, we've been to a lot of bed manufacturers recently, and they work a lot on wooden benches, which are not fixed and can be moved around. So we would expect you to try to move them around if you can. But of course, the next step in the control is if you can't do 2 meters separation, so it's definitely bolted, you can't do anything with it, then of course you have to think of other things to do. And in the video at the beginning, we saw the perspex screens between workers. So if your workers are working side to side, you could put a screen between them potentially. Again, it would depend on the task that you're doing. If they're working face to face, the workers may be able to do that. Other issues are making sure that the task is slightly altered if you can. It all depends on very much what it is that the staff are doing. But you should always think 2 meters if you can. If you can't, something else. And that could be an organisational measure where it's not the space that you're changing, but it's the time that you change. So perhaps 2 people doing something in a slightly different work pattern, or barriers, or at the worst possible option, the bottom of the scale would be some kind of face covering and enhanced cleaning. If anybody's got any specific examples that they're prepared to share, then we can discuss and have some ideas put forward.
Great, thank you, Mark. Have you got anything to add to that from Thornton Ross' perspective?
Well, just maybe a couple of examples specifically where we've got large production lines which are absolutely fixed in situ and require sometimes operators to stand face to face across the line, or side by side. What we've done is we've introduced between those operators large perspex screens, so that there's a long going to the ceiling and a long way either side, so that to provide that barrier between the individuals. And there's any number of examples of those across the site.
Great, thank you. Just moving towards the end of the webinar now, we've got a couple more questions just to squeeze in before we conclude the session. The first of those, Louise, is about the rule of six in a business context. Question and notes, or just ask, what's my business allowed to do in relation to having groups of people into the business, even if they're not in one household?
It's a good question, because one of the things that we're finding when we go to visit companies is that there is confusion about what you can and can't do in the workplace versus the social rules. And I think it's important to note that the rule of six, it's a social rule. It's what you should do in your home or somebody else's home, or in your garden, for example. There are certain exemptions to that rule of six, and the workplace is one of them. So the rule of six doesn't apply in the workplace. You should be looking at all of the other measures we talked about today and all of the ones that are advised through the guidance for your industry.
Thanks, Louise. Donna, did you want to add to that one?
No, I think Louise has covered that nicely. Thank you.
Okay, thank you. So on to our last question, and it's one for Donna in the first instance, and it's really just trying to get trying to revisit the whole question of the cleansing regime, and if we're looking at a typical workplace or typical common areas within a manufacturing workplace, how often should businesses be cleaning, and really how should they be doing that?
Again, it's very much dependent on the size of the building itself, the number of rooms that are in use, and how long actually it takes for an individual to clean that particular area. So by saying 2 hourly cleaning might not be sufficient if we're working with a very, very large building with sort of a large workforce, which might have heavy footfall through particular areas of the building. So essentially an assessment needs to be made really dependent on the size and the rooms and the usage, etc., rather than being able to give a definitive answer on how frequently that cleaning should take place. The products and the products used for cleaning should essentially be a chlorine based product that's made up to the right dilution, so it allows for 1,000 parts per million of chlorine. There are specific products out there which are significantly useful to use, because it means that a tablet of chlorine, a chlorine-based agent, can be just added to some cold water, a litre of cold water, which can then be used within a 24-hour period. So I don't think there's a definite in terms of the frequency. I think it depends on those high-touch areas. So if the staff are actually cleaning the canteen area in and amongst use, and then we've got sort of rails, toilets, etc., cleaned on a regular basis, that should be what we're thinking about. I mean, it's interesting that some companies have introduced sort of continually putting those messages around cleaning and around COVID via word searches and crosswords and quizzes during the working day for staff to actually have that continual reminder about things like cleaning and the areas to be cleaned. So some companies have been quite inventive about how they're putting those messages out continuously.
Okay, thank you. Well, that really comes, I think, to the end of the questions that we've received so far. I think that's been a very helpful and informative discussion. And obviously, I guess our important message is that if businesses do have any specific queries about any of those issues, then we're obviously very keen to speak to them. So if anyone does have any further questions for either the council or any of our partners who've been on the webinar today, then you can call us on 01484 221 000 or email us on covid-secure.inquiries@kirklees.gov.uk, and those contact details will be made available as part of the YouTube channel. So really just falls to me to thank all of our presenters again for their very informative input to the session this afternoon, to thank everyone who sent in questions, and just to encourage you all to keep speaking to us as this pandemic continues. Thanks again for watching, and we'll say goodbye. Thank you.